Hi, my name is Christina Connors, and thank you so much for taking a few minutes to learn about Child Inspired. We are very excited about the products that we are creating to help ease anxiety during childhood hospitalization. Our son, Andrew, when he was 5 years old, he was hospitalized and faced a serious medical illness that required a lengthy stay in the hospital. And we were looking for a way to communicate to our son that he would get home. And we wanted to basically visually illustrate to our child that he would get home and we would get to that goal. So I'm going to show you our original Get Well map. Basically, I asked my friend to create a symbol of the hospital at one end, a picture of our home at the other, and because our son absolutely loves cars and trucks, that seemed very fitting to attach a little monster truck in his case to this road, and we were just going to basically try to visually depict when we would get home. One of the most difficult things, I think, to answer for a child is, when can I go home? You don't know the answer to that. Sometimes the medical team doesn't quite know the answer to that, because during a medical course, time is really not the factor. It's more based on milestones and progression and improvement in condition. So we were looking for a way to depict that for children. What we've developed at this point is a series of illustrations. We call them Get Well maps, and we have a wonderful illustrator named John Donato who does so many wonderful projects with youth and school districts, collaborative muraling, just absolutely wonderful projects that really help to enhance meaningful communication using art as a catalyst for that.
I am honored to be involved with Child Inspired. Specifically, I'm really honored that the set of tools that I have can help them understand and cope with things that are going on during that process. So it brings excitement, it brings fun, it helps the caregivers communicate with the children, it helps the family communicate with the caregivers and the children. I couldn't see a better cause for some of the work that I do as a visual artist in helping with Child Inspired to achieve those goals.
This is our road home based on our original road map with Andrew, but we also have different themes tailored towards different kids with different interests. We have a princess theme, a superhero. Right now we are working on a deep sea theme. So we encourage the family to place a photograph of their child in the left corner and then a picture of their goal. Maybe their goal is going home, maybe that's not feasible yet and it needs to be a series of short-term goals. Maybe it's a pair of sneakers and they're going to walk with therapy, or it's an ice cream cone and they're allowed down to the cafeteria with their family. We encourage there to be another little photo attached under this sticker so that the child helps to make the connection that this represents the child in their medical journey. And then this sticker kind of moves along in correspondence with the child's medical progress. Now, all too often during any medical event, unexpected things arise, whether it's an additional surgery or treatment procedure. So we have created what we call neutral zones. In this one, it's themed as a pit stop. But basically, this is an opportunity, instead of moving the child backwards on the road, it's basically an area to come to and a way to soften some of the medical jargon. Just like cars need new tires, just like princesses, they get tears in their ball gowns, superheroes need extra strength and power. This is an opportunity to kind of soften some of that medical jargon until they're ready to resume their road.
The whole concept is really encouraging, and it's something concrete that patients of all ages and families can benefit from. And I always give families the option at the end to take their board because it's theirs and they certainly can. And sometimes families don't want to take things from the hospital because it's a lot of memories and baggage that's, concrete. It's a physical thing that they have with them that they maybe don't want to remember. But every single family has wanted to take their board and they've been excited. They've been proud, like they earned it because it's a visual representation of the journey that they've been on. It's really powerful for them to be able to feel proud and to look back on their journey and to be able to know that they were able to accomplish all the things they needed to do to get home.
Child Inspired is looking to get these Get Well maps in the hands of children and families. So thank you very, very much for taking the time to learn about Child Inspired. Please take a second to look at our website to learn more about our products, and we look forward to any opportunity to speak in greater detail with you or your staff about the potential to utilize this tool to help ease anxieties during childhood hospitalizations and enhance medical communication with children and families and your medical teams. Thank you.